Title is Antioxidant as a Potential Treatment for Ulcerative Colitis. Antioxidants, as well as oxidative stress, were discussed earlier. Here's a brief recap. The source of oxidative stress is reactive oxygen species, or ROS, and free radicals, and excessive ROS can lead to cellular inflammation. An antioxidant counteracts the free radicals and ROS, maintaining the balance. The balance of such ROS and free radicals is disrupted when they increase excessively or when antioxidant activity is weakened, and this condition is called a state of oxidative stress. Excess amount of ROS and free radicals is said to be the cause of more than 150 diseases, and ulcerative colitis is one of them. Ulcerative colitis is an inflammatory bowel disease that causes inflammation and ulcers inside the colon. There is also a similar inflammatory bowel disease called Crohn's disease. Both diseases have much in common, but Crohn's disease can occur in almost any part of the digestive tract, whereas ulcerative colitis almost always affects only the large intestine. Ulcerative colitis is characterized by diarrhea and bloody stools, spasmodic or persistent abdominal pain. In severe cases, fever, weight loss, anemia appears too. Skin, joint, and eye symptoms may also occur. When ulcerative colitis is suspected due to symptoms such as mucus and bloody stool, the physician first conducts a medical interview, followed by a comprehensive diagnosis through physical examination, stool and blood tests, and colonoscopy. The colonoscopy examines the mucosa of the colon for typical lesions, and the stool and blood test checks whether there is inflammation caused by other diseases, such as colitis caused by bacterial infection. The inflammation usually starts in the rectum and can spread and affect all parts of the colon. Ulcerative colitis is classified into the following type according to the extent of inflammation. Proctitis type, in which inflammation affects only the rectum. Left-sided colitis type, in which inflammation affects the left side of the colon. And total colitis type, in which inflammation affects the entire colon. Ulcerative colitis has two phases, active and remission. The active phase is when the mucosa of the large intestine shows scars and sores and enterolysis symptoms appear. On the other hand, the remission phase is a period when symptoms such as bloody stool have improved and the colon is calm and free of wounds and sores. Since ulcerative colitis is a chronic disease, symptoms may reappear in some patients, and the active and remission phases may be repeated. In addition, the risk of colorectal cancer complications increases 7 to 8 years after the onset of the disease. Therefore, such patients require regular endoscopic examinations even if they have no symptoms. The number of patients with ulcerative colitis is currently estimated to be more than 160,000 in Japan, which is about 100 patients per 100,000 population. The graph here shows the number of patients with ulcerative colitis, and as you can see, the number is increasing steadily. Furthermore, more than 5 million people are reported to be affected worldwide, and the number continues to increase too. The peak age of onset is 20 to 24 years for males and 25 to 29 years for females. But it is known to affect both the young and the elderly. The male to female ratio is 1:1, and there is no gender difference in the incidence of the disease. Ulcerative colitis has been observed to develop in families, and some genetic factor is thought to be involved. In Europe and the United States, about 20% of patients are reported to have a close relative with inflammatory bowel disease, including both ulcerative colitis or Crohn's disease. It is known that there is a genotype that makes a person susceptible to the disease, but having the genotype does not necessarily mean that person will develop the disease. The disease is thought to be caused by a complex interplay of genetic factors and environmental factors such as diet. Although there is currently no medical treatment that leads to a complete cure for ulcerative colitis, there are effective drug therapies that reduce intestinal inflammation of the chronic mucosa and control symptoms. For mild to moderate disease, 5 ASA preparations are considered first. By reducing persistent inflammation, symptoms such as diarrhea, bloody stool, and abdominal pain are significantly reduced. One of the main drugs is mesalazine. In addition, steroid is used in patients with moderate to severe disease. It powerfully reduces inflammation but does not prevent recurrence. Immunomodulators or immunosuppressants are effective for patients who get worse after stopping steroids or who do not respond to steroids. And anti-TNF-alpha antagonist suppresses the action of TNF-alpha, a typical inflammatory substance released by white blood cells. In severe cases where medical treatment does not improve, drugs are not available, or cancer is present, surgical removal of the entire colon must be considered. Although this is the serious disease that causes greater suffering to patients, the exact cause of the disease is still unknown, and it is designated as one of the intractable diseases in Japan. Many studies have long confirmed that the pathogenesis of ulcerative colitis is associated with oxidative stress. There are currently over 900 references on PubMed. Some examples are given here. Intestinal inflammation, for example, is accompanied by overproduction of reactive oxygen species and nitrogen metabolites. To counteract these harmful effects, a wide range of antioxidants are present in the intestinal mucosa. It has been shown that in the intestinal mucosa of patients with inflammatory bowel disease, the level and balance of the most important antioxidants are significantly impaired compared to the normal mucosa. In vivo oxidative damage has also been observed in chronic epithelial cells from patients with inflammatory bowel disease, and some literature suggests that antioxidant may be therapeutic. In other words, ulcerative colitis may be improved by reducing oxidative stress. As in the previous presentation, this experiment was also studied by the antioxidant combination 20X, developed by Professor Infusa of our division. The active ingredients, as shown here, consist of 8 vitamins and amino acids. It has high antioxidant activity and has no side effects. This finely adjusted combination ratio has earned to supplement Japanese and international patents. We have tested whether 20X improved ulcerative colitis in an animal study. A substance called sodium dextran sulfate, or DSS, is mixed with drinking water and given to mice to produce an ulcerative colitis model in about 10 days. The mice go through severe diarrhea, blood loss, and weakness, and can be lethal. We tested whether administration of 20X to the model mice could improve symptoms caused by colitis. At the same time, we also tested a drug mesalazine and compared its effects. Mesalazine is a medication for ulcerative colitis sold under the name Asacol. It has been confirmed to be effective in inhibiting oxidative stress through its hydrogen peroxide scavenging, singlet oxidant scavenging, and lipid peroxidation inhibitory effects. We compared these drugs to 20X, a dietary supplement, and the therapeutic effects of the two in combination. First, oxidative stress level in the blood of DSS-induced ulcerative colitis mice were measured. The DM test was used to measure oxidative stress. Reactive oxygen species and free radicals are difficult to measure because they disappear soon after formation. But by measuring hydroperoxide, a metabolite produced when oxidized, oxidative stress can be measured in vivo with high stability and reproducibility. The value in normal mice is about 100 unit core, but when ulcerative colitis is induced by DSS, the value increased 2.5-fold. The 20X treated group suppressed the increase in oxidative stress. Next, we examined how 20X could affect the prognosis of ulcerative colitis. As mentioned earlier, this model is so intense that death occurs due to ulcerative colitis, and in fact only about 20% of the control group given only DSS survived. The administration of the drug mesalazine increased the survival rate to about 30%. However, there were no significant differences from the control group. On the other hand, the administration of 20X significantly increased the survival rate to more than 50%. Furthermore, by administering both 20X and mesalazine, the survival rate was further increased with significant difference. This suggests that not only did the administration of 20X improve the survival rate, but that combination of the drugs may have caused a synergistic effect. In addition, patients with ulcerative colitis also often experience weight loss due to their condition. We also looked at mouse weight in the DSS model. The control group that received only DSS dramatically lost weight. The drug mesalazine prevented weight loss, but 20X was able to prevent it to an equal or greater degree. To measure the degree of symptomatic relief of ulcerative colitis, the Disease Activity Index score, or DAI score, was measured. The DAI is a combined score of weight loss compared to initial weight, stool consistency, and bleeding. Scores are defined as follows. Weight loss is scored 0 if there is no weight loss at all, and 4 if there is a loss of 20% or more. For stool consistency, the softer the stool, the higher the score, with a maximum score of 4 points for watery stools. For bleeding, the maximum score is 4 points depending on the severity of the bleeding. As you can see, a lower score indicates milder symptoms. DAI can be scored daily during the duration of the DSS treatment. In this study, 2.5% DSS was given as Lipitem and 20X was administered starting on day 8. The results showed that DAI score was reduced in the group given 20X. The result indicates that 20X has the potential to reduce the severity and prognosis of ulcerative colitis. We have also developed 20 mitocontrol, or 20M, which contains 7 additional ingredients to 20X. The ingredients include pantothenic acid, vitamin B1, vitamin B6, vitamin B12, folic acid, and biotin. The added weight is only about 2% of the original 20X. Also, it is only a trace amount added. It dramatically improves the antioxidant effect. Using these antioxidants, we tested in an animal experimental model of ulcerative colitis. We tested whether 20M and 20X could improve the prognosis of ulcerative colitis in a similar experiment to the previous one. 20X improved the survival reduction caused by DSS, but 20M showed the greater final survival rate. Since 20X was superior to 20M until day 14, it is possible that there is some mechanism of action that is different between 20M and 20X. We hope to verify this in future studies. Here is a conclusion. Ulcerative colitis is an intractable disease with no curative treatment established. 20X suppressed increased oxidative stress in the model of ulcerative colitis. 20X reduced symptoms of ulcerative colitis, and 20M have potential to further improve prognosis. However, in order to investigate the mechanism of action that led to this result, further study of inflammatory markers is needed in the future. The results suggest that 20 suppressed the oxidative stress to improve ulcerative colitis and showed the potential of antioxidant therapy for ulcerative colitis. That is all. Thank you for your attention.